Welcome to the deep dive. So today we're taking a closer look at anxiety.
hmm
Specifically, we want to unpack something within obsessive compulsive disorder, or OCD, that can seem really baffling sometimes.
Yeah, we're diving into this concept called core fear.
Right. The idea is to get past just the surface symptoms, the rituals or the thoughts, and understand what might be the hidden engine driving it all.
Exactly. Think of it as the sort of um, fundamental emotional spot that feels really vulnerable right at the heart of OCD.
And by looking at this, we're hoping not just to dump information on you, but maybe spark some of those real aha moments.
Yeah, moments that could actually shift how you understand anxiety and maybe how you navigate it.
We'll be drawing a lot for people like Dr. Michael Greenberg and Dr. Elna Yadin.
Yeah,
Their work's been pretty key here, hasn't it?
absolutely.
Yeah.
Their insights into these deep emotional factors are, well, foundational. We'll also bring in info from the International OCD Foundation, the IOCDF, and touch on how this all fits with treatments like CBT and mindfulness stuff.
And, if you've ever felt just overwhelmed by thoughts you can't shake or behaviors you feel compelled to do.
You're definitely not alone. And hopefully this deep dive gives you maybe a powerful new angle to look at what's going on underneath.
Okay, so let's get right into it. The word obsessed, we throw it around all the time, right? Like, I'm obsessed with this new song.
Right, or a TV show or whatever. Totally normal preoccupation.
But that's completely different from obsession when we talk about OCD. The IOCDF makes that really clear.
Yeah, it's a different beast entirely. That everyday obsession, it might take up some headspace, but it doesn't usually derail your whole life. You can still function.
So what's the clinical side look like then?
Well, in OCD, these obsessions they're persistent, they're intrusive, meaning unwanted thoughts or urges or even images, and they cause significant anxiety, real distress.
You're not just fleeting thoughts.
No, not at all. They can eat up a lot of time and really interfere with your job, your relationships, just daily life. The IOCDF lists common themes, fears about germs, contamination, or maybe causing harm, worries about responsibility, needing things to be perfect, uh, unwanted sexual or religious thoughts, even anxieties about identity or relationships. They cause real disruptive problems.
Okay, so that's the obsession part. Now, this core fear idea, this is where Dr. Greenberg and Dr. Yadin come in strongly, right?
Exactly. They propose this really compelling idea that underneath all those varied symptoms, each person with OCD tends to have one central, really deep-seated fear, a core fear.
And understanding that fear is key.
Dr. Greenberg argues it's, well, foundational, not just helpful, but essential for treatment to be truly effective. Can apparently unlock cases that seem really confusing on the surface. It's kind of a paradigm shift.
So it's not just about the specific worry, like, I'm afraid I'll get sick.
Right. That's a crucial point Dr. Greenberg makes. The core fear isn't usually about the surface thing itself, the germs, the fire, whatever. It's about the emotional suffering the person dreads experiencing because of that thing.
Okay.
And importantly, it's often the fear that this horrible emotional suffering will become permanent, that it will never end.
So can we get more specific? What are some of these core fears? What does Dr. Greenberg talk about?
Sure. He gives several examples, things like a deep fear of feeling constantly judged or ashamed or just rejected by everyone.
That sounds heavy.
It is. Or the fear of feeling totally disconnected, untethered, alone, abandoned. Another one is feeling trapped in hopelessness or helplessness, like there's no way out. Some people have a core fear related to feeling contaminated or impure or just fundamentally off in some way that feels intolerable.
Right.
And for others, it's rooted in feeling, inferior, not good enough, worthless, or like that, just a massive disappointment. Imagine carrying that feeling constantly.
Yeah. Wow. And you mentioned trauma.
Yeah, sometimes the core fear can be about re-experiencing the intense feelings from a past trauma. But it's interesting, Dr. Greenberg's thinking has evolved a bit.
How so?
He now tends to see things like guilt and regret more as emotional consequences that can come from ruminating rather than being the primary core fear itself.
Okay. Got it.
The main idea is that usually there's one dominant core fear acting as the sort of organizing principle for all the person's OCD symptoms.
So if that's the fear, how does it actually, lead to the compulsions and stuff?
Well, the theory is that all those things, the obsessive thoughts, the checking, the cleaning, the avoiding certain places, they're all basically protective strategies.
Strategies to avoid the core fear.
Exactly. The person is desperately trying to prevent themselves from having to actually feel that core emotional pain. Dr. Greenberg uses this really stark analogy.
Yeah.
He says it can feel like having a gun to their head. That's how intense the perceived threat is and how little control the person feels they have over stopping this feared emotional outcome.
Wow. That's powerful.
It really conveys the desperation. But here's the cruel twist.
Okay.
While doing the compulsion, like washing your hands or checking the lock again, might give a little bit of relief right now.
Yeah, temporary fix.
Exactly. But in the long run, it actually makes the underlying fear stronger because you never learn that maybe the bad thing wouldn't have happened anyway, or that you could actually handle the feeling if it did.
So you're stuck in the cycle.
Precisely. It reinforces the fear and keeps the OCD going.
This brings up rumination. Going over and over things in your head. How does that fit in?
Ah, yes. Dr. Greenberg has a really interesting take on this. He doesn't just see rumination as another obsession. He views it as a specific kind of mental
A
compulsion.
mental compulsion, like checking or washing, but inside your head?
Kind of.
Yeah.
He suggests it's a volitional act, meaning you're sort of doing it, even if it doesn't feel fully conscious specifically, to try and neutralize the anxiety or uncertainty that's linked to that core fear.
Okay, so you're trying to think your way out of the fear?
Basically, yes. Trying to analyze it, figure it out, get certainty, solve the problem in your mind to make the bad feeling go away.
And if it is a compulsion?
Then, and this is really important, it means we can potentially treat it using the same principles as we use for physical compulsions, like exposure and response prevention, ERP.
Ah, right, the standard treatment for OCD.
Exactly. It opens up rumination as something that can be tackled with ERP, which is huge.
So what actually sets this whole thing off? What triggers the core fear?
It can be a huge range of things, really, both internal and external stuff.
Like what?
So an internal trigger might be, a random intrusive thought popping into your head, or a mental image, or even just a weird physical sensation.
And external.
Could be specific situations like being in a crowd if your fear is judgment, or certain objects, maybe something that reminds you of contamination, or even interacting with certain people.
So these triggers act like little alarm bells.
Pretty much. They signal danger. That horrible feeling associated with my core fear might be about to happen. And bam, the protective strategies, the obsessions, the compulsions kick in almost automatically.
Okay, this is really starting to click, but actually figuring out someone's specific core fear? That sounds tricky. How do clinicians even do that?
It definitely takes some careful work. Dr. Greenberg lays out a kind of clinical roadmap. It starts with monitoring,
Monitoring what?
tracking the specific triggers, what sets off the anxiety. Then, what are the feared outcomes that pop into your head immediately after? And what do you do then? What avoidance behaviors or compulsions kick in?
Okay, so mapping the sequence.
Right. Then, for each of those feared outcomes, you dig deeper. You review the worst personal consequences. If that feared thing happened, what's the absolute worst part of it for you personally? And crucially, how would that make you feel?
Getting to the emotional core again.
Exactly. You're hunting for that raw emotional experience. The next step is looking across all those different feared outcomes and trying to identify the common emotional threads.
Finding the pattern.
Yeah. What's the fundamental feeling that seems to link them all together? Is it shame, helplessness, feeling utterly alone?
Okay.
Then, sometimes it's helpful to explore if you can connect that core feeling to earlier life experiences. Painful ones, maybe. This isn't always necessary, but it can provide a sense of, coherence, understanding where it might stem from.
Does it have to explain everything?
That's a key point. You need to reevaluate all the symptoms. Does this hypothesized core fear actually make sense of all the person's OCD stuff? Or are there bits that don't quite fit? If so, you might need to tweak the hypothesis. Greenberg calls this the everything fits principle.
Makes sense. It has to be comprehensive.
And maybe the most vital part, the identified core fear has to resonate with the patient. It needs to feel true and accurate to the person experiencing it.
So it's not just the therapist saying, this is it.
Absolutely not. It has to click for the individual.
Yeah.
Then they might monitor their symptoms again, but this time with the hypothesized core fear in mind to see if it holds up day to day.
And refine it if needed.
Exactly. You might refine or adjust the understanding based on new observations.
Yeah.
Oh, and there's also a technique called the downward arrow technique.
What's that?
It's a CBT strategy. Basically, you take a feared thought or outcome, and you keep asking, and if that were true, what would that mean? Or what would be so bad about that? You keep drilling down.
Peeling back the layers.
Right. To get from the surface fear, Like, what if I left the stove on?
Mhm.
Down to the deeper fear, like the house burned down and it was my fault, and I'd be seen as incompetent and irresponsible, which might connect to a core fear of shame or worthlessness.
That sounds like a really useful tool, but I bet it's not always easy to pinpoint this core fear. What makes it challenging?
Oh, definitely. There are hurdles. For one, avoidance and compulsions can be really subtle,
Hmm.
especially the mental ones, like reassurance seeking in your head or mentally reviewing things. They can be hard to spot, making it tougher to see the fear they're trying to manage. Also, some people just genuinely find it hard to identify and label their emotions. If you struggle to say how you feel, it's obviously harder to pinpoint that core emotional suffering.
True.
And another thing, while the core fear itself is usually pretty stable,
Mm.
the surface obsessions, the specific worries, can sometimes shift around over time. This can kind of mask the consistent underlying driver if you're not looking for it.
Right. The theme might change, but the deep fear stays the same.
Potentially, yes.
Okay, but let's say you do manage to identify it. What difference does that actually make for treatment?
Oh, it could be huge. Transformative, really. First off, it allows for a much more precise case formulation. You understand why the OCD is there.
It gives you a target.
Exactly.
Hmm.
It also really boosts the patient's sense of agency. Suddenly, these baffling, maybe shameful symptoms start to make sense as, okay, these are strategies I developed to protect myself from this deep fear. And if they're strategies, maybe I can learn different ones.
So it's not just being crazy.
Right. And understanding the purpose, preventing that core emotional suffering, helps people see how the strategies themselves are actually backfiring, how the checking, the avoiding, the ruminating is actually causing more suffering in the long run. That can be a massive realization.
The very thing you do to feel safe keeps you trapped. We said that before. It really resonates.
It does. And when you map out the trigger to core fear pathway, it often highlights just how unlikely the whole chain of events leading to permanent emotional devastation actually is.
It exposes the maybe irrationality.
In a way, yes, or at least the extremely low probability. This then opens the door for good exposure work. People get to see firsthand that if they don't do the compulsion, the feared outcome usually doesn't happen. And
Mhm.
crucially, even if they feel awful for a bit, the distressing feeling does pass. It's not permanent.
Which directly challenges the core fear.
Precisely. And this understanding allows for much more targeted and effective exposure exercises. If your core fear is shame, the exposures will look very different than if your core fear is contamination.
Tailored treatment.
Exactly. It also helps sniff out those subtle avoidance behaviors or mental compulsions that need addressing. And ultimately, all of this often cultivates a much greater willingness to engage in ERP, which, is tough, but incredibly effective.
So this focus on a deep underlying fear, is that specific to OCD or does this kind of thinking pop up elsewhere in anxiety?
That's a great question. Well, the core fear label and the detailed framework we've discussed come largely from the OCD world, particularly Greenberg and Yadin's work.
Uh-huh.
The general idea that deeper emotional vulnerabilities underlie anxiety is definitely relevant elsewhere. Take generalized anxiety disorder, GAD, for example.
Where the worry is more free-floating?
Right. Some models for GAD propose that there might be core fears operating underneath that constant worry. One model, called the deconstructing anxiety model, suggests core fears related to fundamental loss.
Well, so what?
Things like fear of abandonment, loss of identity, loss of meaning or purpose, even fear of death, the ultimate loss. The idea is that the specific worries might jump around, but they're all kind of filtered through that underlying fear of loss for that individual.
Interesting. So identifying those deeper drivers could be useful across the board for anxiety.
Potentially, yes.
Uh-huh.
It suggests a common principle might be at play.
Now, we've talked a lot about core fear, but you also hear about other concepts like intolerance of uncertainty and metacognitive beliefs. How do they fit in?
Yes, crucial point. The core fear doesn't exist in isolation. It definitely interacts with those other factors. Intolerance of uncertainty, or IU.
That's basically hating not knowing things, for sure.
Pretty much, yeah. That's
Eh.
a strong negative reaction to uncertainty. And it's a huge factor in OCD, sometimes called the doubting disease, right?
Mm.
So when a situation triggers your core fear, if you also have high intolerance of uncertainty, that uncertainty feels absolutely unbearable. It massively fuels the urge to do compulsions, to try and get rid of the doubt, to get certainty, to prevent that feared feeling.
So the core fear is the what I'm afraid of, and IU is the I cannot stand not knowing if it will happen.
That's a great way to put it. And then you have metacognitive beliefs.
Beliefs about Thinking.
Exactly. Beliefs about your own thoughts, like believing that just having a bad thought means you're bad or that you'll act on it, or believing thoughts are dangerous or need to be controlled.
Okay.
These negative metacognitive beliefs can cause you to misinterpret normal, everyday, intrusive thoughts, which everyone has, by the way, as serious threats. Which, guess what?
Activates the core fear.
Bingo.
Mm.
And drives things like rumination, trying to figure out or neutralize the dangerous thought. There's actually a whole therapy approach, metacognitive therapy, MCT, that focuses specifically on changing these beliefs about thinking.
So for effective treatment, you might need to look at all three.
Often, yes. Addressing the core fear, maybe with ERP, tackling the intolerance of uncertainty with specific techniques, and challenging those unhelpful metacognitive beliefs. It's
Yeah.
often an interconnected web.
It paints a much fuller picture. Okay, we've mentioned CBT and ERP a lot. Where does something like mindfulness fit into all this?
Good question. So CBT, cognitive behavioral therapy, is definitely a first-line treatment for anxiety. It focuses on changing those unhelpful thought patterns and behaviors directly.
Right.
Mindfulness-based approaches like MBSR, mindfulness-based stress reduction, or MBCT, mindfulness-based cognitive therapy, offer a sort of complementary skill set.
How so?
They focus on cultivating present moment awareness, noticing your thoughts, feelings, sensations, but without judgment, just observing them.
So not directly changing the thoughts, but changing your relationship to them.
Exactly. While mindfulness might not target the content of the core fear like ERP does, it can be incredibly helpful in reducing your overall reactivity to difficult internal experiences, like the anxiety that comes up during exposures.
Ah, so it can make ERP easier to tolerate.
Precisely. If you can learn to sit with discomfort a bit better, you're more likely to stick with the exposure exercises. Plus, mindfulness principles are woven into other therapies too, like DBT and ACT, showing how valuable that skill set is becoming across the board.
This has been incredibly insightful, really digging deep here. So as we kind of wrap up, what's the absolute key thing you want someone listening, maybe someone struggling with anxiety or OCD, to take away from this?
I think the main message is that understanding this idea of a potential core fear gives you a deeper, more personalized way to look at what's going on. It helps you shift focus
Shift from what to what?
from just battling the surface symptoms, the thoughts, the urges, the rituals, to understanding the fundamental emotional vulnerability that might actually be driving the whole thing.
And what are the big payoffs if you can identify that core fear?
Well, like we discussed, it can bring a much greater sense of personal agency, like you're not just subject to these random symptoms. It leads to a clearer understanding of why things are happening.
Yeah.
And importantly, it allows for much more targeted and hopefully more effective treatment, like rumination-focused ERP.
It helps you see how the solutions, the compulsions, are actually part of the problem.
Exactly. Seeing how those avoidance and compulsion loops, even though they promise relief, actually keep you stuck in fear. That insight alone can be incredibly powerful.
So if someone's listening and this is resonating, maybe they're thinking, what are my core fears? What's a first step?
I'd really encourage some thoughtful self-reflection. Think about the examples we discussed: fear of judgment, abandonment, helplessness, contamination, worthlessness. Do any of those really strike a chord?
Hmm.
You could also try that downward arrow technique on your own, gently. When a worry pops up, ask yourself, okay, and if that happened, what would be the worst part of that for me? And then ask it again about the answer. And what would be so bad about that? See where it leads you.
Just gently exploring those deeper layers.
Exactly. No pressure, just curiosity.
And if people want to learn more or perhaps seek professional help with this,
The International OCD Foundation website, that's iocdf.org, is a fantastic resource. Loads of information on OCD, treatments like CBT and ERP, and they have a finder tool for qualified therapists.
that's iocdf.org.
Yep. And as we mentioned, looking into mindfulness approaches can also be a really valuable addition for many people, usually alongside therapy like CBT.
This has been a fantastic deep dive, really illuminating. Thanks so much for breaking it all down. Any final thought for our listeners?
Just maybe this: taking that step to recognize and try to understand your deepest fears, those core vulnerabilities. It's not easy, but it can be such a powerful first move towards really navigating anxiety differently, towards building genuine resilience, that self-awareness, that understanding. It really can be a key to unlocking a path towards feeling better, more sustainably.